Hi, everyone. This is Caroline from Fiat Integrative Health in Franklin, Tennessee, and you're listening to the Fiat Health Podcast. We believe that now more than ever, the healthcare industry has become a place of confusion. And over the years, we have been asked countless questions about what true health and integration for the whole person looks like. Join us every other week as we explore topics ranging from primary care and women's health to counseling and spiritual health. We're so glad you're here. Hey, everybody. Welcome back to the Fiat Health Podcast. This is Caroline Hartley. I'm a family nurse practitioner here at Fiat Integrative Health in Franklin. And today I am joined by Ashlynn Matthews, a fellow family nurse practitioner here at the clinic. How are you today, Ashlynn?
I'm good. How are you this morning?
I'm good. We've been having some really fun technical difficulties. So this is our fourth round of recording.
Yep.
But it's going to work this time.
It will.
So today we're super excited, or I should say Ashlynn's super excited to jump into cholesterol. And I really love that you love cholesterol.
I do. I love talking about cholesterol. It's probably my favorite subject, and that's not a joke. That is truly how I feel.
Yes, as you've said before, it is the hill you will die on.
Correct.
The soapbox of your career.
It will be forever and ever.
Which is awesome. So today, we hope this is helpful to anybody who has ever had a cholesterol panel run or plans to have one done. They are absolutely standard with any wellness panel or just general panel if you go to a primary care physician. We're going to talk about what is cholesterol, the different values you're going to see on the labs, how we do things a little bit differently here. We run some other tests as well, how we look at cholesterol. I just think that, and I think all of you will think by the end of this, that Western medicine or kind of the traditional standard way to look at a lipid panel just really is a disservice to all of humanity.
Yeah.
And there's so much better that we can do. And so that's what we aim to do here at the clinic. So let's just jump in. Tell us, what is cholesterol? What does this word even mean, Ashlynn?
Sure. Well, I think cholesterol is like a buzzword for people. They get scared when they're talking about cholesterol, but I like to remind people that cholesterol is a vital fat in your blood. It's designed to support brain health, hormone health, cellular repair, all of the things. And so I like to pay close attention to it because it's important in all body processes, and not all cholesterol behaves the same way. So starting off, cholesterol is not the enemy. It's, like I said, it's a vital substance. But what can happen is when improper diet and lifestyle, I should say, kind of takes control, we then result in damaged arteries, inflammation, etc. Mm-hmm. So I like to explain it as cholesterol is like firefighters running to the fire. So they're not necessarily the bad guy. They're there to help and fight the fire that we've created in our heart, in our arteries with inflammation, things like that. So there's several different types of cholesterol. And on a typical lipid panel, like Caroline was saying, we get 4 results. We get a total cholesterol, which to me means absolutely nothing. It's just a formula. We get an HDL, or high density lipoprotein. You get a triglyceride number, and you get a LDL number, or a low density lipoprotein. So you get 4 numbers on a traditional lipid panel. Mm-hmm. Here at Fiat, we practice a little bit differently. We draw those 4 numbers in addition to another 1.5 pages of information on your cholesterol. And that is called an NMR lipo profile.
Yeah, NMR.
NMR, yes. Mm-hmm. And that gives us particle numbers, particle size, breaks down all of the different cholesterol results, and gives us a full picture of what's happening with your cholesterol. And that is able to give us a better predictor of heart disease or of perfect metabolic health. Mm-hmm. So that's why we do that panel.
Yeah. So we obviously have total cholesterol. And then basically the LDL and HDL are both cholesterols.
Mm-hmm. Right.
It's just a matter of what kind of cholesterol it is. Right?
Right.
So what exactly, explain to me what an LDL is.
So LDL or low density lipoprotein, those are your traditionally bad, quote, bad cholesterol, but they're not all bad necessarily. LDLs are just made by the liver in response to inflammation or triglycerides, fat, essentially, to help your body detox those fats through the liver, essentially. And so on a traditional lipid panel, like we were saying, LDL, you just get one result for an LDL. But that doesn't really give us the whole picture because there's really two different types of LDLs that we're looking at. We're looking at small, dense LDLs and large LDLs. So when we are talking bad cholesterol, I'm referring to small, dense LDLs. I like to describe them as small, fluffy tennis balls. They tend to get stuck together. They're small and they're dense. They don't float. They get stuck together in the arteries of your heart and increase your risk of heart disease. Inversely, the larger LDLs are like dodgeballs or balloons. They're more rigid. They can float right through. They're buoyant. They get to where they need to go to do those important things like we were talking about, regulate hormone, cellular health, all the things. So an NMR lipo profile will break down those numbers and tell us just that. Typically, usually their cholesterol is made up of about 80% of those large LDLs, which is what we want. We want your LDLs to be large in order for them to be effective. And so that's kind of LDLs in a nutshell. Yes, they can be bad, but they're not all bad. So will I ever treat an LDL result based off the traditional lipid panel? Absolutely not, because that doesn't give us all the information. And the goal is not to get that LDL number as low as we can, because then we don't have LDLs doing the role that they need to be doing. So, and then HDLs are your good cholesterol. I describe them as the trash collectors. Their job is to go around, grab onto those small or bad LDLs and help excrete them through the liver. So yes, we do want a high number of HDLs. Some providers will kind of put a cap on HDLs, but we'll talk about ideal lab ranges a little bit later. But something to keep in mind, and back to the total cholesterol number, the reason I kind of disregard that number is because it could be high only because your HDLs or your good cholesterol is high, right? So it's not necessarily an indicator of metabolic health or heart disease, referring to that total cholesterol number.
Right. Just looking at the total cholesterol look, because it's like, well, what kind of cholesterol is it?
Exactly. Your LDLs could be quite low and your HDLs are, high according to the lab. Then your total will be high. But
doesn't necessarily mean that there's an increased risk for cardiovascular.
Right.
Health.
Exactly.
And so, I think, so we look at lipid panels primarily from, or I'd say most of the research and literature in the medical world is around cardiovascular health.
Correct.
But also it has a huge role in our metabolic health.
Yeah.
Maybe can you explain that a little bit about why we're not just worried about heart disease when we look at a lipid panel?
Sure. So, when we're looking at a lipid panel, that third number we have is triglycerides, which is a really good indicator for metabolic health, because triglycerides, essentially, their primary role is for energy storage. So they're a source of energy. When the body needs energy, it releases triglycerides from the cells, from fat cells primarily, and uses them for energy. Usually triglycerides are stored in body fat. And so, we know that increased visceral fat, increased body fat, increased BMI, increases your risk for all kinds of chronic diseases, metabolic disease, heart disease, etc. And so triglycerides are important when we're talking about metabolic indicators. We want those triglycerides to be low because triglycerides, when they're not used effectively for energy, are turned directly into small LDLs in the blood. So we're turning them into those bad or atherosclerotic cholesterol molecules. Triglycerides can change day to day. Fasting, non-fasting, they fluctuate often because it's primarily based off what you eat. Triglycerides are the best indicator for diet, showing me how you eat. I can see that just based off a triglyceride level.
So it's like when the triglyceride cup overflows, let's say.
Right.
Then they're like, oh, we have too much we have to convert this into those small LDLs,
Exactly.
which are the sticky, more dense ones that we really don't want in our blood because they can be more invasive than the buoyant ones.
Exactly. So yes, looking at all these numbers as a whole gives us a good indicator into cardiac disease markers, but gives us more of an indicator into metabolic disease because, cardiac disease is a result of metabolic disease, right? So there's lots of other labs that I take into account when looking at your cholesterol, your glucose levels, insulin levels, hemoglobin A1C, things like that. But I look at this as more of a metabolic picture versus a cardiovascular picture.
Okay, so explain to us. So we did LDL, HDL, triglycerides, total cholesterol, right? So that's all the things you see on a normal lipid panel. Now let's dive into a little bit more what we see through an NMR lipoprofile and why those matter, in terms of the apolipoprotein, ApoA, ApoB, all of that.
Yeah, sure. So the NMR panel is going to give us the exact breakdown of those small versus large LDLs so we can see that number. So if your LDLs are elevated, I don't really care. I want to see if your small LDLs are elevated. So this panel is going to tell us exactly that. It's also going to tell me the size of your LDLs, which is helpful. APO or apolipoproteins are also helpful to help understand LDL and VLDL function. So
what's VLDL?
Very low dense LDLs. They're all the same essentially. So apolipoprotein B these are transporter molecules, first of all. ApoB is a transporter molecule on those small LDLs. So we obviously don't want those small LDLs to get stuck in the arteries of your heart. So if your ApoB proteins are high, that means that you have a greater chance of heart problems because those LDLs have transporter molecules that are taking them into your heart and allowing them to get stuck, essentially. Inversely, ApoA is a transporter molecule on your good cholesterol or your HDL. So we want that number to be on the high end of normal, right? Because we want those HDLs or those trash collectors to be transported to collect those small LDLs and excrete them through the liver. So I like to draw these because they're just good indicators of your current and future cardiovascular disease risk.
And what about, maybe let's go into an optimal range that we look for on labs.
Yeah. So our optimal ranges are not necessarily what the optimal ranges are on your LabCorp or your Quest report or even in the textbook. Right. So there's a lot of evidence that shows that triglycerides less than 60 are optimal. I honestly couldn't even tell you the upper range on what a LabCorp. I think they want it less than 150, technically, according to the textbook, but there's a lot of evidence that shows triglycerides greater than 60 are going to, as Caroline kind of explained, overflow and turn into those bad LDLs. So triglycerides less than 60 are ideal. HDLs are that good cholesterol. Ideal range is for females as close to 60 as we can get it. For males, closer to 80. And that, again, improves your heart health. They're those trash collectors. And they're cardioprotective, meaning they don't allow those LDLs to stick. We want your HDLs to be high to protect your heart. When we're talking small, dense, or those bad LDLs, I like to see that number less than 500. And LDL size, we want greater than 21.0.
And that's an average size.
An average size, yeah, exactly, of those large LDLs. And then apolipoproteins, there's kind of mixed evidence on what they should be, but like I said, ApoB is attached to those bad LDLs. So we want that number to be low, less than 90, ideally. And ApoA, most people say greater than 100, but that kind of just depends on your risk factors. So those are kind of nuanced.
Okay, great. Let's jump into kind of how diet influences all these levels, maybe what we can do about it, some myths around that. Tell me, what does it all mean?
Sure. Well, I think the biggest myth is that fat is bad. A lot of people are like, oh, my cholesterol is high, so I stopped eating red meat and I stopped eating butter. And I stopped eating whole eggs. Like, oh, the egg yolk is so bad for my cholesterol. And I am just so disappointed by modern medicine and the American Heart Association that they've indoctrinated people. I don't know if that's kind of a strong word, but, they've put out this, these guidelines that need to change.
Yeah.
So the biggest things that affect your cholesterol negatively are processed carbohydrates and sugar. Mm-hmm. So packaged foods, which we talk about this in every podcast that we film, but it truly makes a huge difference in your cholesterol. I'm sure we could do a little study. You're going to eat a big bowl of processed carbohydrates, so that's pasta or whatever tonight. And I'm going to check your cholesterol in the morning and your triglycerides are going to be through the roof. Mm-hmm. And then in a few weeks, you're back to your normal diet. You've decreased those processed carbohydrates. You're getting your carbohydrates from primarily whole food sources. Mm-hmm. Your triglycerides will be back to less than 60. It's as simple as that. And I've seen that. And sugar, processed sugars primarily turn directly into triglycerides and then LDLs in the blood. So those are the foods that we need to be focusing on. And earlier I mentioned inflammation is the issue in the arteries, not the cholesterol. Those are also the foods that cause inflammation in your whole body, right? So
everywhere.
Right. Not fats like butter, eggs, or red meat, high quality red meat, I should say. It's those sugary foods, processed carbohydrates.
And the oils, like unhealthy oils.
Right. Inflammatory oils.
I think that's why a lot of people see a lot of success on gluten-free diets is not because they necessarily are even intolerant to gluten, like some people are, like who have celiac or something, but because when you go gluten-free, you pretty much strip your diet of so many processed carbs. Because we don't think like, oh, but it's bread, like processed carbs sometimes doesn't compute with bread and pasta, let's say. But unfortunately, unless you're grinding your own flour and making homemade pasta and bread, it's completely processed.
Right.
When you buy it from the store. And so that's one thing I think can be easy just in terms of like decreasing the sugar and processed carbs is like, just go gluten-free. And don't replace it with gluten-free crap.
No. Yeah.
Get the gluten-free bread. No. Just like take that out. Mm-hmm. That's why a lot of people see really good results on Whole30 and stuff, because it does. That's exactly what it does, is taking out those processed foods. So, Okay. So healthy fats then are not the enemy.
Right.
We shouldn't give up egg yolks and we shouldn't give up butter.
No.
Or fatty meats. So tell me, like, what are some really great things that have been researched and proven to help balance out that lipid panel and give us the good cholesterol that we need?
So big one is omega-3 rich foods. So that's fatty fish like salmon, mackerel, sardines, flax seeds, chia seeds, nuts. Really, any nuts and seeds are wonderful for their anti-inflammatory properties. They cut triglycerides down. Foods high in fiber also, because, I mentioned this briefly before, but the liver plays a huge role here. Mm-hmm. And when our liver is unable to process and detox properly, we can see elevated triglycerides or elevated cholesterol in general as a result of that. So increasing fiber to help support the liver, which produces and excretes LDLs and VLDLs. So through those fibrous fruits, vegetables, legumes, all like kind of, those Mediterranean diet staples that can be really helpful. And again, that's where we're getting those carbohydrates from those whole food sources, not from processed food sources.
Right. Because carbohydrates, like you don't want to have a zero carbohydrate diet. I mean, you really can't.
No. Yeah.
Your body can't handle that.
Right.
Like in terms of like some people with keto, will go like super, super low carb.
Yeah.
And it's not the carbohydrate itself that is the enemy. It is what kind of carbohydrate is it?
Right.
And so definitely the whole foods are good to go.
Mm-hmm, definitely. And red meat is a big one for me. Red meat is not inherently bad. Mm-hmm. Red meat has really high quality fats, can be really great and anti-inflammatory properties. But like we've discussed in the past, we need to make sure we're eating quality meat products, right? Yeah. So no offense to the big box grocery stores, but you're not going to get that there.
Yeah.
Right. The ground beef that's, low fat at,
Right.
70-30 or 60-40. Is that the best? Not necessarily. We need to eat what the cow is blessing us with, right?
Yeah.
With its full caloric benefit from a whole fat red meat source, right?
Mm-hmm.
And then your lean meats are also great. Chicken, turkey, things like that. And as we mentioned before, eggs are not the enemy. Please, if you take one thing away from this podcast, eat the egg yolk.
Eat the egg yolk.
Please eat your egg yolk.
Oh my gosh. I was trying to, omega-3s in general are just like researched out the wazoo for all kinds of health benefits. And the Mediterranean diet, because it's more fish heavy, I think is part of it, because you have like high level of omega-3s. So yeah, I try and I've said this before, like convince my kids that sardines are the bee's knees.
Yeah, baby-led weaning. Give that baby a sardine, I'm telling you.
Yes.
Introduce
and
it
like a little
early.
mayo and salt, throw it on a cracker, they'll never know. Or if
This
you're
is
like
delicious.
my husky 4-year-old, you just tell him it's going to make him strong and big.
Yeah.
And he just eats it right up, thinks it's the coolest thing ever.
Yep.
I still have trouble. I try, but
Yeah.
sardines
Maybe
are
I'll try
hard one.
again when I'm not pregnant.
So if you are like, let's maybe talk about some things. We talked about things to avoid. So again, going back to the packaged foods, obviously, read food labels. Another big one that we mentioned is just seed oils. So they are inflammatory. There's just no question about that. And so canola oil, vegetable oil, soybean oil, the more grass-fed butter, high-quality olive oil, coconut oil, avocado oil, and tallow you can use, the better. What are some supplements that if you're like me and you're like, I can't eat sardines and fish all the time, my budget can't afford it, for one.
Yeah.
What are some supplements maybe that could be helpful if your lipid panel is off, with the caveat, obviously, of like, please don't take these willy-nilly.
Right.
These are only to be taken with the advice of a informed, medical provider.
Mm-hmm.
Because some of these can definitely, if you don't need them, they're not good for you. I think probably omega-3 is the only one on here that's like probably anybody could take omega-3 and benefit. But
Yeah. And before I talk about the supplements, I just want to do a quick note about statins. We're not here to talk about statins, first of all. That could be a whole other podcast. But I also, if you're listening, do not take yourself off a statin if you are on one. My only note is that current statin guidelines don't take into account any of the factors we've already talked about. So that's all I have to say about that. Talk to your provider about that.
Yeah, we definitely do not reach for a statin.
No.
Like if a typical provider would look at your lipid panel and be like, oh, well, your cholesterol's high.
Right.
We should put you on a statin.
Right.
We do not do that unless there is a clear risk factors involved.
Right.
So,
right.
Yes, don't take yourself off, but you should certainly look into it a little bit and talk to your provider about it.
Correct. Because, the whole message we're trying to get across is that cholesterol can be affected greatly by lifestyle interventions. So
Absolutely.
that's a caveat. But yes, there's lots of supplements. Like Caroline mentioned, omega-3s are excellent, likely safe across the board for everybody. They lower triglycerides, they improve lipid metabolism, and they reduce that very low density lipoprotein production in the liver. So I always say, read the labels of the omega-3s that you're buying. Typically, I'm just going to be honest, the omegas available at Kroger or Publix or wherever are usually very low dose. So read the labels. Sometimes people bring in what they have. I'm like, this is great, but you need to take 6 of these. So look for a 2-to-1 EPA to DHA ratio, and we'll put all of this in the notes too, so you can kind of refer back, with at least 2,000 milligrams of EPA. So sometimes those over-the-counter omegas only have like 500 to 1,000. So keep that in mind. CoQ10 is another good one. Usually pretty safe across the board. But again, make sure we're talking to your provider before you start any of these. But CoQ10 helps reduce oxidative stress, which is causing that inflammation in the arteries of your heart, supports healthy LDL function, and can lower the risk of it can fortify those arteries of your heart, essentially. So I like CoQ10 for those reasons. And then some extras, which these are case by case, but I like to utilize plant sterols. There's a lot of excellent research on plant sterols and their effect in healthy lipid metabolism. Red yeast rice can be helpful as well by blocking cholesterol production in the liver. And then L-arginine can sometimes be helpful when we're talking artery health, but this is one that you do not want to take if you have migraines, depression, autoimmune disorders, lots of things. So again, talking to your provider about all of these supplements. And the other one I like to mention is fiber. So, if a majority of Americans are not getting enough fiber in their diet, I can tell you that right now. And so if you don't think you can get enough in your diet, add in a fiber supplement. It can make the world of a difference when we're talking LDL synthesis in the liver. So I like to throw that one in too.
Okay. Awesome. We've got a couple more minutes here. So a few things just as like a key takeaway, if you don't already come to our clinic, that maybe you can go to your provider to ask for. Again, the NMR lipo profile, even if your doctor's like, I don't know how to read that, that's okay. We just gave you the tools to do it. So they can send you a copy of it and you can say, I'm going to look at my small LDLs and my large LDLs and all of that. So the NMR lipo profile, and then the coronary calcium CT scan. So we order these and recommend them, especially with anyone who has high risk factors for cardiovascular disease. Most insurances don't cover this, but any imaging center, like you'll see them advertise for it all the time because you can just like walk in and ask for it. Costs like $150 to $300. Sometimes they run specials. It's a pretty quick test, but it's just imaging done on the heart in particular to say like, is there plaque buildup?
Right. It's very basic imaging, but it can be really helpful in assessing your overall cardiovascular disease risk. So
absolutely.
It's standard practice for me to order these on people who have consistently elevated small LDLs, even though the guidelines don't recommend that. just caveat.
We won't talk about that. Another test to add on to ask for is the ApoA1, ApoB with ratio. So that is actually separate from the NMR lipo profile. But again, those numbers give you a good insight into your overall cardiovascular risk, especially kind of looking forward. We really love looking too at a fasting glucose and hemoglobin A1C. So a glucose and an A1C are very typical at any primary care provider. And if you're getting fasting labs, then when you look at your glucose level, it is inherently fasting. It doesn't have to say fasting glucose, but that will definitely give you some great insight into metabolic health. And sometime we'll do a whole podcast all about like metabolic dysfunction and whatnot and dive into glucose and A1C and all of that. But those are just some other labs we like to look at when we're looking at the full picture of the lipid panel.
And I think just to wrap up, I think something important as providers, if there's any providers listening, but it's important for me to remember too that, I always at every visit am having conversations about what people are eating and specifics. So if I ask someone, what's their typical diet look like? And they're like, oh, well, we eat a lot of, protein. Dinner's usually like a protein, a starch, and a veggie. And, we eat a fairly healthy diet. What does that really mean? Okay, well, I work in an office, so I have to go out for lunch, but I usually pick something healthy. Well, what does that mean to you? Right? If it's a salad with a healthy protein, but then you're, dumping whatever dressing they give you on that said salad, right?
Sure.
It's just little things like that can add up. You're listening to this and you're like, well, I kind of already eat this way, but what are the little things in your diet that could be affecting these numbers? So is it the bottled salad dressing that you're putting on your salad? Or are you cooking with, I don't even know what that stuff's called anymore. I haven't bought it in so long. Pam Bray versus olive oil or avocado or coconut oil.
Sure.
What are those things we're eating for breakfast? Are you eating carbohydrate heavy breakfasts, with lack of protein in your diet? Are you eating only egg whites, not whole eggs? So I always spend a lot of time diving deeper into that diet conversation because we all, even myself, I'm guilty too. There's always improvements that you can make in your diet. And that's the whole point that I'm trying to get across is that even those tiny little changes can make a huge difference when it comes to your metabolic health. And cholesterol, in my professional opinion, is the best way to see that reflected on paper. My favorite thing is to draw labs, and we have a long conversation about this. And, I always like to be encouraging, because truly it can make a difference. And then 3 months to come back and it's significant. Your labs look like you're a totally different person on paper.
Right.
And so that's encouraging for you to see as the patient that, just these little things. I stopped, eating out for lunch. I'm bringing my own lunch to work now, and my triglycerides are cut in half.
Yeah.
Simple things like that can make a huge difference when we're just talking about cholesterol.
Yeah, absolutely. I love that, because we like to see results. It's not just like, let's just do this and who knows if it's helping.
Yeah.
Okay, awesome. Well, this has been such a fun conversation. Thank you so much, Ashlynn, for standing on your soapbox for us. We love it. And feel free to reach out anytime if you guys have any requests. We love to hear them. Otherwise, we'll see you next time.
See ya.
Thanks for listening to this week's episode. To learn more, you can visit our website at fiathealth.org. If you enjoyed this episode and you'd like to help support the podcast, please subscribe to our show on your favorite podcast platform and leave us a review. This helps make the podcast easier to find. Lastly, if you'd like to reach out, ask a question, or suggest a topic for a future show, send us an email at media@fiathealth.org. God bless.